Gravando. Okay, hi everyone. So thank you for coming. So my name is Juliana and I will be your assessor for today. So, um, so before we begin with our individual presentation, because I send you the email so you know what you're gonna do today, but I will do a quick now remember for you to refresh your mind. So first you're going to begin with your individual presentation. So you need to, which of you guys, you need to tell me work health and safety hazard you identified and how it was communicated. So what's your communication action? Then we will move into a group discussion where each of you ask and respond to questions. And then finally, you're gonna agree on what work health and safety issues should be reported to your supervisor. So we're gonna have like three big moments for our assessment for today. All right. So I will explain the assessment process and ask you to confirm that you understand and agree with the procedures, okay? So the assessment will be recorded, and I will be observing how well you communicate in a workplace style group discussion. So this includes your ability to report clearly, ask questions, listen actively, and work with others. So you are encouraged to speak clearly, avoid slangs, please, and interact respectfully, all right? And support is available if you need at any time. So Luis, if you customize, I will customize for you a little the pace for you. So I will check in with you more often, all right? And you're welcome to use your chat function to type your responses or your answers if you feel more easier to do it. So guys, can you tell and can you confirm if you understand the assessment process and are you happy to continue? So you can say like yes, or you can put your thumbs up. All right. So, okay. So before we begin, please hand up your photo ID to your camera so I can confirm your identity. So let's start with Luis. Your identity, so your ID. So you have it in your phone. All right. Okay, Luis, thank you. Okay, thank you. So Danny, you the second one. So a little bit more close. All right. So thank you. Yes, 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 I could see. Thank you. And you have some? The last one. All right. So very clearly. Thank you, guys. All right. So let's do a quick check. So can you all hear me clearly and see the screen? Please give me the thumbs up or yes. All right. So Luis, are you comfortable with how to use the microphone or chat functions to participate here?
Yes, I believe so.
Okay. Okay, guys, finally, let's start our first part. So the individual verbal report. So each of you will have up to 5 minutes, all right? So introduce yourself, then report a work self-safety hazard from event one, and explain the communication action taken. And then ask the group if they have any questions. So let's start with you, Helson. So you have up to 5 minutes.
So my name is Helbison. I'm a registered nurse and I work at the base hospital. The safety hazard I identified recently was we had a patient that had finished surgery and we were changing the patient's bed. And after the patient was moved to another bed, I was removing the bed linen and we found a needle. So in the bed linen, so that's a sharp risk there for us.
Yeah.
So initially, I collected the needle using a forceps, which is what's required, and disposed of the needle in the sharps container. And following that, I had to notify my manager, so I informed my manager, but I also had to write an incident report using our incident report system.
All right. So you can ask the other ones if they have any questions. So you can ask them.
So do you guys have any questions on that? Do you guys understand what happened?
Yeah, I understand.
Yeah, I understand.
Yeah, do you guys have any question?
No, all good, all clear.
Yeah.
Okay, thank
I
you.
have one. The needle was, do you think the needle was dirty, or was it like a clean needle with
The needle was visibly clean, and because we don't use needles, it's very rare the situations where we can need to use needles on the patient. So we could. It's very unlikely that that needle was used in the patient. So it's more likely that that needle was used for preparing medication. So it's possible, but obviously we cannot be sure on what the needle, how the needle was used. But yeah, it's more likely that the needle was not used in the patient, but used to prepare medications.
Are you happy, Luis? Yeah, with the answer? Yep. All right. Thank you, Helpson. So
Thank you.
now, Danny. So you can start. You have up to 5 minutes.
Hi, thank you. Hi, my name is Daniela. So I'm a human resource coordinator. So I work in a manufacturing of some milk. And the triple hazards that I identify in my area, because I work in the admin office. So we find some water leaking coming from the walls.
Wow.
So what I did, during the heavy rains, so we started having this leak. So what I did, I just isolate the area with some signs of slippery hazard, and I just contacted the cleaner and asked her to clean it up. And after that, I report this hazard to the safety and manager, and he just starts to contact the facility manager just to have a look where is the leakings coming from and how is the next step to just fix that. And of course, I just told my colleagues from that we share the same office that a potential risk of slippery there. So to avoid that area, because we still have people checking and seeing what was going on there. That's it.
Any questions? So you can ask.
Any questions, anyone? Everyone understood?
No accidents at that time, right?
No accidents. Thankfully, no accidents.
Yeah.
Yeah, I don't have any questions. Thank you.
All right. So let's go to you, Luis. So it's your turn. So you have up to 5 minutes to your.
Okay. My name is Luis. I'm GP. I work as a GP in GP facility in KMC Hospital. And yeah, one situation that I can remember recently, I had a patient, she was pregnant and she stopped feeling movements few days prior, like 1 or 2, can't remember exactly. Then I was about to start an ultrasound to check the fetal heartbeat. And I prepared myself, I put her in the bed, and everything was ready to start the procedure. I put the gloves on, and when I got the probe, the patient was undressed. Then when I grabbed the probe, I realized blood on the probe, on the probe and on a cable. And I should stop the procedure, and I couldn't. Unfortunately, the patient realized that as well. I started open disclosure, said I have to stop and clean properly. And then when I finished, I did it, and I finished, and I escalate to my the doctor in charge. And that day was good. He he organized a little meeting with everyone and explained blah blah blah. But I think after that, when he escalated to our supervisor, the highest level, the doctor that is in charge of the emergency. I think that time what he did wasn't great. He just sent a message. He took a photo. This doctor in charge that day took a photo, and I'm assuming sent to the boss, the big boss, and the big boss shared this photo in the WhatsApp group and wrote underneath, "We can do better." Something I think wasn't a very good communication at that time. But the day of the incident, I think that the doctor did very well. But when instead of do some formal education or something better, send this message only was pretty poor for me. And yeah, that was the case. If you guys have any questions, I'm happy to answer.
No?
So do you know what happened? So what? Oh, I don't know if I missed this, but what happened after? How did you manage to clean the equipment?
After? What do you mean? Sorry.
So did you use the equipment after, or had it cleaned, or
No, I cleaned. I cleaned. Yeah, and I clean up the blood and everything. I wait a few minutes to dry up the alcohol, then I perform the procedure.
Okay.
Yeah. All right, guys. Thank you. So we completed the first part. So now let's begin our group discussion, okay? So in this first part, please listen to each other report. So for now, which of you guys you need to tell me? 1, work health and safe goal. 2, work health and safe hazards and communication actions you have taken, and the best way to report these issues to your supervisor. And then you're gonna go to the step 2, where you need to ask 2 questions for each of you. And then you're gonna finalize with agreement as a group. But let's do the first step. So maybe you can start now with Dani. Dani, can you tell me, so 1, work and health and safety goal, 2, hazards and the communication actions, and the best way to communicate to your supervisor?
I think one of the goals is trying to minimize any safety incidents at the workplace. So try to make everyone to return to their homes in the same way that they arrive at work. So, and I think the triple hazards could be the slippery floors as well. That could be any water spills or any product spills that could cause this slippery floor. And another one could be like, another point I think for someone that work in an office is about the chairs. If the chair is properly to be used, if there are nothing broken that can cause a safety incident as well. And I believe the better way to report that is fill out the incident report that we have. We have some forms and report to the managers as well, and trying to communicate with everyone about what is happening to avoid any other safety incident or someone that is not aware of that is walking the area or using this chair or something like that.
All right, thank you, Dani.
Thank
So, Helpson, it's your turn now.
So the first thing is 1 goal.
The goal, and then you need to tell me 2 hazards and the communication action, and the final one you need to tell me the best way to communicate to your supervisor for these issues, for the 2.
Yeah, so 1
Yes.
goal of Well, it's always gonna be very similar to, I guess, the answer, because the main goal is to prevent incidents, or to prevent incidents that could harm any person in the workplace. So could be the employees, or could be visitors or customers or clients, depending on the facility. But we do have, working in a hospital, in direct care, in patients' direct care, there are some hazards sometimes that we don't consider them initially as hazards. So one hazard is dealing with an aggressive patient. That is one thing that it can happen, or relatively often, or either because the patient is confused because of the clinical condition, or sometimes just a behavior or insatisfaction with the service. So that's one hazard. Another hazard, very common for us, is sharps. So we are manipulating sharps all the time, and there's especially needle stick injury is still the leading causes of incidents for nursing staff in the hospital. Usually, most of the communication can occur verbally in the moment of the incident, because we usually have a manager on site. And if we don't have a manager on site, we always have an after-hours manager in the facility that we can report to them. However, we have some formal means of communication. So we do have an incident management system that must be completed for every incident. And it's electronic, so it distributes the communication to the relevant stakeholders in the hospital. So, yeah. So basically using our electronic incident management system.
Okay. Thank you, Helbson. So now, Luis, your turn. So remember, you can pause, you can take notes, or type in the chat if you need it. All right? So you can start.
Sorry, one second.
No.
I dropped my headset. Okay. Yeah, definitely. The most important thing is the things that Helbson and Danny, they already have said. It is keep the employers and the customers safe. But on the other hand, it's not the first thing, but most important, but it is also very important, is reduce the number of sick leaves, accidents, and workers' comp, increase performance and efficiency of the sector. It's secondary, but it's still important, and they are linked. Then what is the second
And
one?
then you need to describe two hazards, and then
Okay.
what the type of the communication was taken.
Yeah, two hazard in, I don't know, my area hospital. I think it's for everyone. Floors, like if it's wet or not, doors, safety doors and fire doors, and as Helbson said in his case, sharps, very important in hospital as well, sharps and drugs. And yeah, the best way to communicate, I think, firstly, is to discuss with the doctor in charge at that day, or the doctor or nurse or whatever in charge that day, the immediate ones, the next step. And if you're not happy, I think a formal report would be the next step.
Okay, thank you. Thank you, guys. So now, take a moment to ask each other questions to understand the reports more deeply, all right? So you should ask at least 2 questions each. So now we can start with Helbson. So you can ask 2 questions to Danny, and then Luis gonna do the same, 2 questions to Danny.
So Danny, I think you said you work in an office. So do you have a manager on site to report immediately? And what's your impression when you report this? Do you think action is taken immediately, or you think it's delayed?
Yes, we always have a manager on site. We have the specifically safety manager on site, and of course we can report to our directly manager as well if you need. And if no one is available, any manager that is available at the moment. And I think the company that I work for, safety is their priority. So they take everything very seriously, and they always take actions and trying to avoid and to fix it any issue that is being reported straight away.
Mhm. Okay.
Okay, Luis, so now you can ask 2 questions to Dani. And if you need any help, I will be here. All right? So you can use the chat, you can use your notes. It's fine.
Okay. Now, Dani, my question is, I know you work in office, but my question is about the fracture, the floor, the process. If you have like a big accident, I guess, I don't know. The question is, for example, fire or chemicals or something like that. Do you guys have or the company offered a proper training for that, like evacuation or stuff like that? And if you during the period of time you have been working in this company, if you did see something big
Yes,
in terms of accidents, chemicals or burns or I don't
Yeah.
know, floods, something like that.
Yeah, so yeah, we have the emergency exits, of course, in every point of the factory, and we always do some drills to training people how to evacuate it and show the points and the midpoint outside of the factory where is each area has been located, just to check if everyone is there and is safe in this situation. And in regards, to the safety incident, as I'm part of the HR, so I have been involved in some. We have one that was major one that was still going, like the work compensation thing. So yeah, I sometimes be part of the investigations. Depends on the situation. And I have been involved for the payroll side as well, because of course we need to go through the iCare and all the work compensation payments for this person. Yeah, so unfortunately, I have been involved in not just one, but a multiple safety incidents at the company.
Thank you.
All right. Thank you, guys. So now, Dani, you can start the questions to Helbson.
All right. So my questions is in regard the system that he mentioned about that they use to report the safety incidents. There are any like when you guys use this system to report, they send a communication to all the stakeholders, all the employees in the hospital, explaining about what happened and the outcome of that. And this is the first question. And the second question, like, it's similar to the one that you asked me. Do you think that, for example, on the needle example, do you think the action and there has been an investigation to check how this was ended up that and how to avoid this situation again? How do you guys deal with this incident after this happened, except for the report part? But how is the outcome?
So for the system, yes, it is an electronic system, and part of the questions you need to answer is which department the incident happened. And you can also identify if that incident relates to other departments as well. So, for example, I could have said in this needle found in the bed linen that it happened in the surgical ward, but it involves the operating theaters as well, because the patient had come from the operating theaters. So once you complete and submit your report, the manager of the departments indicated in your report are automatically notified. So then it becomes the responsibility of that manager to and work health and safety team. The work health and safety team are notified automatically as well. So the work health and safety review the report, and there is a report. There is an incident classification system. So classifying 4 levels. So from near miss to cause a severe injury to a person or death. So depending on each level, there is different levels of investigation as well. But usually the manager of that department will lead a group. They need to form a group of other stakeholders, and they have 30 days to perform an investigation and provide a report on that investigation with what were the causes, what are the root causes, and what are the action plan to prevent that from happening again. But once the investigation has completed and they implement the final report with the implementation of the interventions, then it goes to a repository of incidents that is any employee can check what happened. In regards to the response time, really depends. If the risk still exists, usually there is an immediate action. So let's say, for example, there is an important piece of equipment that is faulty. So the equipment will be either be repaired or be put out of service or something like this. But some of and I think it might be a characteristic of the healthcare setting, but some of our incidents, we actually only have a conclusion after the process of investigation. So not necessarily we'll have an action immediately when the incident was reported, because we need to wait the result of the investigation. And sometimes you identify in the investigation causes that you had not identified on the day of the incident. So yeah, it sometimes can take days.
Okay, thank you. Now your turn, Luis. You can ask two questions to help.
I have a pretty sad story that happens with me this week, and I would like to know not your opinion. What you would suggest if you were in charge? I have a patient in a nursing home. She's 91. She was, because she's dying. She's almost 91 years old, and she was pretty functional, and she was very active and used to walk through the rooms, and she had lots of friends, and she was pretty functioning. Then I think the story is a little bit weird, but I think they were giving medications, and she was walking through the rooms, and she went to see a friend, and she took 2 tablets of one of the other residents, 100 milligrams of amitriptyline and 100 milligrams of tramadol. And she's like this size. I think she has like 40 kilos. And guess what happened? She slept for 3 days, and she had aspiration pneumonia, and now she's on syringe drive, having medications for the end life medications. Then I don't know. It's pretty weird. What could we do different to avoid this kind of things? And I don't know, in terms of medications and in terms of safety, because I know it's almost impossible to keep people in their rooms during this period of time, period of the day, to give medications. But it's pretty unsafe because people can walk through the facilities every time and no one can stop. And when the RN or AN are giving medications, sometimes they are busy doing things. And it happened with me. I was examining patients, and when I looked to one of my sides, I can't remember, I saw another resident almost in my neck. I said, what we're doing here? I don't know. Do you have an idea or
Basically, yes. So
opinion?
the process of medication administration in the facility needs to be reviewed, um, because if this patient, as you just described, had this incident, but I'm assuming that because of the characteristics of nursing homes, some, I wouldn't say most, but some patients will have dementia, confusion, or any other type of cognitive impairment that it's definitely a risk to have medications available to them that's not controlled by the nursing team. So I guess my assumption is we need to identify why these tablets were available to the patient. Um, and is that because there was a breach in current procedures? So maybe the current procedures are safe, but there was a breach. Or maybe the current procedure is not safe, and therefore reviewing that and implementing a safer strategy is definitely necessary. So yes, examples are these, like we have trolleys with locked doors, or for the patient for each resident, for the medication for each resident. The medication room should be locked. The cupboards with the medications should be locked as well. And only people who can manipulate and handle medication should have access to them. But yes, definitely a big incident caused a very significant harm to the patient, and yeah, should be investigated appropriately.
All right, thank you, Helpson. So now, Danny, you're gonna ask 2 questions to Luis, and then you will Helpson.
Okay, so let me think. In regards to the blood situation, about the equipment that you find, you just mentioned about that this information was shared in our group WhatsApp. I just think that it's coming to my mind now that there are any private statement that the patient needs to sign to not be share any confidential information, because of course I don't know if her name, but the situation definitely was shared that happened with her. So how is the implications for this person? Like how you guys trying to protect this information for the patient side? And in regards that, of course, this was a uncomfortable situation for her to be with everything that is happening, and I assume that she was worried about the issue that she was facing. How she coping with that? How she deal with that?
Yeah, no, was a near miss. The blood wasn't in contact with her. That's so when you have a near miss, you don't have to go further. But yeah, definitely, maybe an open disclosure should be done. And yeah, I did it because even if I decided not to do because it was a near miss. I didn't have any other thing to do because she saw that. So it was a near miss. I did open disclosure. I explained what's happened. I don't know. In this case, she was fine, but maybe she was mentally unwell because she wasn't feeling the baby moving for 2 days. I don't know. I can imagine if on top of that, if she sees or if during the procedure, I realize, oh, blood, and I say something, probably or maybe potentially can cause more mental distress or more anxiety. Then in this case, I think what we could provide is support there. Nurses, doctors, giving all support that she needs. I don't know if she starts panic, a medication. If not, just a good conversation, and then we would go from there. As a patient that has acute mental health distress, I think it's more like that.
Okay, Danny. So now your Your turn, Helbson.
Luis, I would like to ask, like drawing from Danny's question, you did mention about open disclosure. I would like to ask, like, as a medical officer, do you feel that you and your colleagues receive appropriate training from the facility to deal with open disclosure? I mentioned in my example previously that one of the hazards that we face in healthcare or in acute care facilities is patients or even visitors may be reacting aggressively towards the health professional. So performing an open disclosure is a very delicate moment. So do you feel that medical officers are prepared for that? They receive support from the organization to how to plan that open disclosure moment, which type of safety planning you would put in place, because that is a very challenging moment, and the family or the patient may not react as expected. So how do you feel about your training to perform open disclosure?
Yeah, in my organization, we have when we start, you may know, we have lots of online trainings. Then this is a part of these trainings, but it's not enough, I think, because, for example, we have clinical stuff, we have simulations and trainings and lots of things involved, from the theory to the practice or the situations. Like one example, for example, we have regular simulations regarding different clinical situations. But yeah, I at least during my time there for 3 years, I've never seen anything related to accidents, open disclosure, or stuff like that. So we have like an online training, online material. It's part of the core, but yeah, no, it's a gap. It's a gap. We don't have. We are, in my case, I'm 44, and maybe I have more experience than like a 24, 25 years old doctor. And yeah, would be very important and to have training like that. I believe so. Yeah, good question. I've never thought about this. And now I realize I had only online material and I never had any discussion, any training, any support about that.
Yeah,
Good question.
interesting. I
Thanks for
guess.
that.
Yeah.
Are you planning to introduce this?
Good. Yeah, because I'm assuming that an open disclosure process would involve other professionals. You may have to involve
Yeah.
social workers, health allied, security. And yeah, I guess it's not as simple. Yeah, I probably feels to me that only theoretical training probably is not enough.
True. No, definitely it's true. Because I think when without clinical scenarios, the only ones that I could remember is breakthrough bad news, and it is a clinical scenario, like how to manage and to handle with agitated patient is a clinical scenario. But yeah, never regarding open disclosure or yeah, near miss or mistakes or harm, stuff like that.
Yeah. Okay. Thank you.
Yeah, yeah. They have lots of things to improve.
Okay, guys, thank you. Any other question for each other? No? All right, so great discussion so far. So now as a group, guys, let's decide together. All right, so we have like 3 questions and try to choose one of you to answer the questions after your discussion. So you need to answer the first one. So what work health and safe goal do you want to achieve? The second question, so which two hazards should be escalated to your supervisor, and what are the communication actions taken? And what the best way to report this to the supervisor? So I have a few moments, guys, to discuss, and then let me know your answers. All right.
Okay, cool. So goals. What do you think, guys? I think goal should be, I don't know, my general, creates a safe environment, a place that everyone knows that
Safe.
people that are working and the clients or patients, they can go and feel safe. I think it's the most important thing.
Yep.
What do
Yeah.
you think, guys?
Yeah,
That's it. Yeah, the main
I
point.
agree.
They can, leave the place in the same way that they arrive, like safe and well.
Yeah, and I think it's important to be reminded as well that it involves everyone. It's not only the employees or not only the staff, but visitors. I mean, in our case, in healthcare, we have family involved or customers, depending on what type of facility it is, any person visiting. We may have other people from other organizations that may need to come to the organization, like delivery, storage, and things like this. So, yeah, I guess creating a safe environment to any person that needs to interact in that environment. So the next question was
About the
Which two
hazard.
hazards?
True hazard.
How should be escalated to your supervisor? Yeah, and what the communication
Okay.
actions taken? Yeah.
I guess we work in different scenarios, but we can try to think two hazards that may be in common for all of us. So,
I think the slippery hazard can happen in the hospital
yeah,
and in the office as well, because it could be any water leaking or anything. Yeah.
Yeah, and
chemicals. Because you are an affector as well.
Yeah. Because it's a common one. Yeah.
So I guess we need to decide two. So let's go to slippery, hazards, and fire.
Yeah, and the fire, yeah. Because it could happen both.
And
Yes.
floats is important.
And how the last one is the best communication means of communication to management.
Actually,
Is that
the
the
same
question?
question. So you need to tell me what's the communication action should be taken. Yeah, for these two hazards that you have nominated.
So communication action.
Yes.
So
first.
So the first is slippery.
Yeah.
Slippery. Yeah. Environment.
Yeah,
well, for slippery.
Yeah.
Well, I guess we can consider. Can we consider that isolating the area and put a sign there is a communication strategy?
Yes.
It is.
Yes, it is.
And then reporting.
Reporting, yeah.
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 And about the fire.
Oh, the fire.
Yes, and the fire door and evacuate.
I think they're quite the same. Yeah.
Yeah, I think we'll be quite the same. Yeah. Try to not panic. Make people
alarm.
panic. Find the exits.
Yes, I think the most immediate communication means the fire alarm. So,
yeah, the fire alarm.
Close the fire door, evacuate.
Yeah.
And probably consider as well that some communications is already in place. For example, the signage for the emergency doors, or where fire extinguishers are located, or water hose access. So these are already signs of means of communication that should be already be in place as well.
Yeah.
And again, reporting.
And the best way to report these to your supervisor. The last question.
Yeah. I think to report to the supervisor will be the formal reporting, because I think most of the place has like a form, properly formed, that you need to put all the details, where happened, the time, who was involved, I think would be similar as well for different. Yeah.
Yeah.
All right. Do you all agree on those points, guys? So the first question, a safe environment. So the second question, so about the slippery and the fire, and the actions you'll be put like a signals or talk with your supervisor. And the best way is the formal report.
Yes.
All right. Luis, are you comfortable with this summary? Would you like to add anything or suggest a change, or you are happy with those answers?
No, I'm happy. I think it's the answers are very complete.
Okay.
I like it. Yeah, I think we did a good job.
All right. So throughout this discussion, so I noticed that you all respected each other communication preference and used polite, workplace appropriate language. So well done on staying clear, calm, and professional. So we have now completed the group discussion section. So we have demonstrated effective listening, questioning, sharing ideas, and reaching agreement as a team, as a group. So guys, only just a minute, I need to only finish my notes. So all participants appear seated in a safe environment. No hazards identified. Technology is working well and no visual signs of distress. All right. So thank you, everyone. So thank you, guys. That completes our assessment. So before we finish,
Thank you.
I would like to hear your feedback. So how did you feel about the way the assessment was conducted? And the other point I want to know, any changes with technology or anything you'd like to suggest for improvements? So let me know, guys. Anyone can start. Give me your feedbacks.
I think the assessment was conducted in a very easy manner. I think the fact that we could do this assessment online as well is already very convenient. So we all are doing that from home, reducing we having time to travel or being able to schedule this in a more convenient time for everyone. So I think the communication was great. Maybe a suggestion for me, because throughout the assessment I noticed that we had to ask the instructor, the questions multiple times. So maybe a suggestion would be maybe sharing a screen with the questions, or maybe sending the chat written the questions so we could review the question while discussing. I guess that's the only suggestion I would have.
Okay, thank you, Helpson. Any other feedback?
Yeah, I have the same.
Agree.
Yeah.
I agree with Robson. Yeah.
Okay, guys.
Yeah, I have the same opinion. Was very good assessment. The assessor was pretty clear, but yeah, the only thing I should say, the same Hobson said, maybe the questions could see or send to us our reading material, support material, but it was pretty good.
Okay, so thank you again, guys, for your participation. So you receive your assessment outcome very soon. So please feel free to email me, or if you have any further questions. All right. So have a good night and see you next time.
All right, thank you.
Thank you.
Bye, guys.
Bye.